finally, after I don't know how many months, 6 months or something, this is the 3rd episode of AA Podcast. And our guest today is Raoul and Semi.
Hello.
Sweet. Okay, self-introduction.
Okay. Do you want to go first?
Sure. Hi, everyone. My name is Raoul. I work as a senior policy analyst at the Department of Health and Wellness.
Hi, my name is Samat. A lot of people know me as Semi, and I am an Indian immigrant to Halifax. I moved here in 2014 to go to university at St. Mary's, and I do a whole bunch of things. My 9-to-5 job, I work in digital media at a marketing agency, but outside of that, I'm a content creator, I'm an influencer, I'm a model, actor. I do a whole bunch of those kinds of things. And I also organize events for BIPOC creatives and artists to come together and hang out.
It's amazing. Yeah, all in one.
Oh, I
like all in one. Perfect. So today, what we're going to discuss is something about health and health system. Mm-hmm. That's why Raoul's here. But before that, we have to ask some quick questions for our guest. First one, what's your favorite food?
Do you want to go first?
You go first. I went first last time.
Okay. I mean, I think for me, like Indian food is always going to be like very, very near and dear to my heart. But the thing that people don't necessarily know about Indian food is that it's so diverse. Like every single state has different food. Like depending on where you grow up, you're eating different kinds of food. So my family's actually Punjabi. So homemade Punjabi food is just my absolute favorite. So that would be like where I lean. But also, if I had to like die tomorrow and I had to eat my last meal, it would be like Indian mangoes on toasted white bread with butter. People are like, "Oh my God, that's weird."
That sounds cool.
I swear to God, like sliced mango on toasted white bread with butter, delicious.
I'll tell you what, it sounds better than avocado toast.
Oh, it is. It is.
Sounds sweeter.
Hot take, but true.
Yeah.
So which Indian restaurant is your favorite in the city, in Halifax?
In terms of like very, very authentic food, I find Adda, which is in Spring Garden Place, which is where like the Starbucks is on Spring Garden. It's like downstairs. Right. They have really great food, and they actually opened up like a restaurant on Spring Garden Road. It's called Badmash, and it's right next to Your Father's Mustache. It's where the Captain's Boy used to be. Right. Oh, wow. They have excellent food, and rasa as well. If you're looking like for a more fine dining kind of experience, rasa also off Spring Garden Road. Yes. Great option. So they have rasa and sura, and rasa is more like fine dining, like sit down meal, and sura is more like tapas style, like finger food and stuff.
Rasa was so impressive. When you get in, you got like a hot towel, and you just sanitize your hand. It's just so fun.
At the fear of sounding a little pretentious, I'm gonna say foie gras. If I had to die tomorrow, as you mentioned, and I had one last meal, I would get a foie gras made au torchon, served with a blueberry coulis.
Okay, I know what blueberry coulis is. I don't know what anything before that is.
I think it's geese liver is the first thing. Yeah. I got that one. What's the second thing?
The blueberry coulis.
No, the thing before that.
Oh, au torchon. So it's just the way you would prepare it. So you get the liver, and then you can do a whole bunch of different things to it. But this is basically you get the liver and then you cure it in Doug fat for 3 days. And then you slice it up and serve it on some freshly made bread. I prefer my sourdough, but any bread will do for that point. And then sprinkle on that coulis on top of that, and it is decadent beyond belief.
All right, let's jump to our main topic today, the health. Yay! So Raoul, you brought some very interesting information here that we want to learn. Yeah. Because we want to know everything about the health system. Yeah. Because I don't even know nothing.
Yeah. I mean, I think coming here as an immigrant is a little bit, one of the biggest culture shocks is actually being able to navigate the medical system here. Because Will and I were talking about this before, actually. So coming from South Asia, I also come from, like, I grew up with certain economic privilege, which allowed me to access private healthcare, like the best healthcare and stuff like that. So in India, we do have like a government health system, but if you have certain economic privilege, you're able to access private healthcare. So we would just like walk in to see a doctor and they'd be like, oh yeah, just wait and the doctor will see you. And we also have our medical infrastructure is supreme. We have so many doctors, so many hospitals and things like that. But coming here, everybody has access to the exact same facilities and it's universal healthcare. It's free for everybody, which is the way that it should be. Like income should never determine whether you can access world-class healthcare. But knowing that I have to have a family doctor after I graduate, I have to get on this list. I can't just go to a specialist. I have to go through my family doctor to get to a specialist. I also came as a student. So as a student, you have access to the health like center at your university. And I had that for 5 years and life was all fun and breezy. And then you get out and you get put on this list. And I was on the list for a year and a half, got a family doctor. My family doctor moved, so I got put back onto the list. And now I don't have a family doctor anymore. So I use like the Maple app if I ever like need anything to talk to a doctor like on the app. But you might not get an appointment with a doctor in the day. So like you might go like 2 weeks without even having the opportunity to talk to a doctor. And it's been a hard thing to navigate. And I realize now, talking to a lot of Indian students who are coming, or like recent Indian immigrants, they find it really hard to navigate this system because it's such a big change. You can't just walk in and see a doctor.
All right. And a lot of, my community members from Chinese community, we don't even know we can get a family doctor. What do you brought on table today? Let's discuss something.
Yeah.
So I've had the privilege of working on a number of different projects as a senior policy analyst, research and evaluation with the Equity and Engagement Division of the Department of Health and Wellness. Today, what I'd like to talk about is the Health Equity Framework.
Okay. What is that?
I'm so happy that you asked that. So the Health Equity Framework is an ADIRA guide. When I say ADIRA, I'm referring to equity, diversity, inclusivity, reconciliation, and accessibility. We've more commonly probably heard of this acronym as EDI.
Okay.
The Department of Health and Wellness has taken a stance to change that for us and for hopefully influencing others to include reconciliation and accessibility separately from diversity, inclusivity, and equity. Recognizing reconciliation deserves its own place, and recognizing that accessibility includes things such as those that suffer from addictions and mental health.
Right.
That is a disability, and therefore accessibility for those folks need to be different than what an equity group who is racialized is demanding.
Right.
Also, linguistic barriers. Those are accessibility issues and not
Totally.
necessarily a visible racialized barrier.
Absolutely. Okay.
So the Health Equity Framework is an ADIRA. It also sounds better, right?
Yeah.
ADIRA guide to the health system, right? So we're hoping that this Health Equity Framework will help address different factors that contribute to the disparities of health outcomes for our equity-seeking groups.
Right.
That's good.
Yeah.
We need that.
Interesting. Yeah, we definitely
'Cause
do. We definitely do.
You mentioned a few barriers. I think me or a lot of people, especially in the Asian community, we are facing that barriers.
Navigating the system as a whole, like having something to like bridge that gap when you like get off a plane and have to navigate this whole thing that it's an entity, an institution in itself, and not
Right.
really knowing how to navigate that. I think
Yeah.
having that bridge to be able to do that is very important.
That goes to another part that we've heard about is that folks want to be treated or served in the healthcare system by folks that look and sound like them. That seems like a no-brainer.
Right.
Like if I go see a doctor and I start talking about something and I'm like, Doc, I ate this fish sandwich yesterday and it was with like how do I explain this to you, doctor? It was with the kuchara. I think it had something like if the doctor doesn't understand what I ate,
Yeah.
right? I'm like the achard, like it was probably something in the achard. If I say that to the doctor and he doesn't understand me, then
That would be cool if we have that, because I'm facing my community is facing the language barrier hugely.
Right.
We have I think the good thing about Indian community is the language is not a huge barrier, but for Chinese people it's
Colonization.
Yeah. Ugh. Silver lining.
Wow.
I think this is a good segue to talk about where the Health Equity Framework came from. So the Health Equity Framework comes from a few different places. The first place that I'd like to mention it comes from is Bill 96. For those who don't work for the government, Bill 96 was an act that was put forward dismantling racism and hate. There are specific deliverables, and one of them is a health-related deliverable. So this provincial bill passed in the spring of 2022, which means that subsequently, within those timelines, there is a health deliverable responding to the anti-hate and racism.
Wow, only in 2022? That's
Yeah,
so
just last
recent.
year, literally last year.
Coming
So
around.
that's the first place I would say that it comes from. But I mean, there's more to it too, right? The government that was recently elected has also put forward a plan called Action for Health. And in Action for Health, there are a number of solutions which you can actually look at online. Check out that link. You can see the different solutions proposed.
Right.
And specifically under solution number 6, we talk about addressing the factors affecting the health and well-being of our equity group folks,
Okay.
racialized populations. And lastly, there's a health transformation office. The Health Transformation Office is part of this new leadership that the government's proposed around health
Right.
and health systems. And in this Health Transformation Office, one of their must-do can't fails is addressing health inequities
Right.
and equity and engagement initiatives as they pertain to healthcare and health system interactions with folks.
Okay.
So these, this is, to me at least, this is a proactive approach that the government's taking, recognizing that if we're going to really double the population, if we really are going to do that, and we recognize that we're not going to look like we look like right now
Right.
in 25 years, that we need to make some changes in our infrastructure. And rather than just shoot in the dark, we're going to make some informed changes.
Right.
And to make those informed changes, we need to engage with community.
Absolutely.
We need to find out what they want, what everyone wants.
Right. I have a question for you. So when you're looking at health,
Yeah.
that includes the umbrella of mental health and
Oh, yeah.
everything that looks like. Okay.
Yeah, so that's a really great question. When I'm referring to health, I'm referring to the health system.
Right.
And the health system extends all the way out from your emergency room care to primary care,
Right.
Which is your health practitioner, medical doctor, family doctor, down to psychologist, a massage therapist,
Right.
psychiatrist,
Okay.
social worker, including dentistry, optometry. All of that is the health system.
Right.
So the health equity framework, hopefully, I mean, like, we can create the document, but if
Yeah.
nobody reads it,
Right.
right? So we're going to create this and we're going to put it out there, and hopefully there'll be something in there for everyone, for all of the whole health system, so they can look at it and consult it and move forward together.
Right.
The key word here being alignment,
Right.
right? Like IWK, NSH, DHW, all these acronyms and initialisms. The hospitals, the health authorities, and the government, we're all trying to align.
So this is like a universal language.
Yeah, that's a great way to look at it.
Oh,
We talk
yeah.
about universal access and how there's a lot of talk about, I know in the post-secondary institutional field, to teaching, universal access in teaching and like lowering barriers. We're taking a similar approach to this health equity framework. Not exactly the same, but very similar in that we're trying to get everyone on the same page at the same time. Rather than having double work, right? Like if the health authority was engaging with community and finding out what they needed, specific to the way that they interact with them, and then IWK did that, the hospital did that, and then we did it as the taxpayers and the government and all that. There's a tremendous overlap, and so if we
Right.
could just all have the conversation, right? So as part of the work that I'm doing with the health equity framework, engaging with community, this community, along with other communities, and also I work with a few different working groups. One of them that comes to mind is the Health Equity Metrics and Data Indicators Working Group. That working group has members from the Nova Scotia Health Authority, Dalhousie University, the IWK, Department of Health and Wellness, and we meet twice a month, and we talk about indicators and outcomes as they pertain to the information we're collecting from community.
Right.
So like you're talking about language barriers, for example, right? And your interaction with the healthcare system and that barrier. So I take that to the working group and I say, okay, we need someone or somewhere to tell me about patients' experience through languages. How do we measure it? Who's got that data? Because if I have that data, then we know where we are and we know where we need to go.
Right.
And then we determine an outcome. This is what we want to, how much we want to improve it by.
Right.
And this is where we are. But I can't do that by myself, right? I need to collaborate with someone at the hospital. I need to collaborate with the health authority. I also need to collaborate with like physician services out of my branch, as well as the unions, as well as like nurses and everyone, to know who can offer these services in these languages, what languages are the patients asking for, and how does it look like?
So question for you. So
Yeah.
who are the entities within Nova Scotia who are like collaborating on this framework? And when you're talking about racialized groups,
Yeah.
Do we have identifications for who those racialized groups are?
Yes. Okay. So that's a two-part question. I'll start with the equity groups that we're
Right.
engaging with. This isn't a comprehensive list. This is just like where we're starting. It's an ongoing engagement process, and there are lots of intersecting identities. And so we're keeping the list fluid.
Right.
But to start off with, first and foremost, are Mi'kmaq and Indigenous folks in the province. And then the African Nova Scotians and people of African descent are also identified. And then we have a broad statement about racialized communities. That's where you start to get those intersecting identities, people coming from different groups. Our 2SL LGBTQ 2S plus community is also being engaged with, people with disabilities. And then there's an immigrants, newcomers, and refugees branch of work. This is a part of that work. This is part of that engagement. Hopefully we can reach out to you, and you can send me an email if you have any additional questions and all of that. I'll be happy to answer you in French, English, Spanish, or Creole, your choice. And then lastly, I think one of the other places we're looking at is faith-based communities.
Oh, interesting.
Because what we realize is going to faith-based communities, you will also reach out to other intersecting identities that we might slip through the cracks.
Right.
That's pretty smart.
Wow, that's
Yeah.
so interesting.
And then in terms of our partnerships, like who's helping us develop all of this from a system level point of view. So from a health system point of view, we have a health equity partnership table, and that involves, your hospitals, your health authorities, all of those powerful, very high decision-making folks, deputy ministers and all that stuff. The Department of Health and Wellness, that's where I'm at. The Office of Equity and Anti-Racism. That's also a branch of government, but not directly related to health, because Bill 96 actually rests with them and lives with
Okay.
them. So technically, through the health equity framework, we could say there's a legislative accountability to your equity and anti-racism folks, the Office of Equity and Anti-Racism. Whereas like for us at Department of Health and Wellness, it's more of a project secretariat, right? Like administratively kind of putting it all together. And as I mentioned, the Nova Scotia Health Authority, the IWK, the hospital, seniors and long-term care as another branch of government, Office of Addictions and Mental Health as another branch of government, the Office of Healthcare Professional Recruitment, another branch of government, the
I don't
QE2
even know
Foundation.
that was a thing.
It's not your fault. It's new.
Okay.
With the new government, a lot of times there's like a bit of a shell game that happens and
Right.
reshuffling. Like for example, 2 years ago, prior to this government, LAE was what we referred to before as Labor Advanced Education as a branch. Now it's LSI, Labor Skills and Immigration. So they just
Oh.
move these little pieces around, right? So like for
Okay.
example, seniors and long-term care used to be part of the Department of Health and Wellness. Now they're off on their own.
Right.
The Office of Addictions and Mental Health also was under Department of Health and Wellness, but now we're off on our own.
Okay.
Healthcare professionals recruitment also used to be with us, but now they're off on their own. So,
Right.
it's good. I feel like the decentralized approach really allows for a more tailored and agile movement and solutions. Of course, we also have non-institutional partnerships, community-based things. So
Right.
post-secondary institutions, CBU, Dalhousie, NSCC, SMU. Do we say SMU? Do we say SMU?
We say SMU.
I'm not from around here. I was going to say
SMU.
my Toronto's showing. So all of our post-secondary institutions, we've pitched them and asked them to be a part of it. Some have already said yes. Some are still on the fence about it. The Nova Scotia Health Community Health Boards, those are also on board. Community health boards, I'm not surprised if you're making these faces and you don't know who they are, because community health boards exist in a rural setting across the province.
Okay.
They're not necessarily for us over here.
Cool.
So they're on board. And then the Federation of Nova Scotian Municipalities, which is really important because, again, when we're talking about rural communities, it's just they know their folks better than we do.
Right.
And then we are working with local EDIRA groups and stakeholders, like you folks at HALITUBE. Thank you so much for having me. And then we have others just on there that I'm sure I'm forgetting to mention, and I'm gonna get comments in the YouTube video. I'm sure I'm gonna get emails, and I will do my best to amend that and add them to my list.
Awesome, perfect. That's a lot of information.
Lots of partners, lots of people.
Well, we want to make sure we capture as much as possible, right? So we do have, for example, a survey
Yeah, I was actually going to ask you. I was like, so how do, like, as a racialized person, like,
Right.
are you guys still collecting information? Okay.
So the health equity framework has a survey where you, as a Nova Scotian, can go and fill it out, and you don't have to be a racialized person for it. Obviously, we want that perspective.
Right.
We want equity group perspectives, but we want everyone to tell us how you interact with the healthcare system and how that went with you.
Like as an immigrant, like I just find I have to fight my right sometimes. Like I have to do an extra step
Yeah.
to let you know this is what I'm having. Because if I don't let you know, you may not know this is what I'm facing.
100%,
Yeah.
100%, nobody knows.
Like, a lot of our role is education.
100%.
Yeah.
And then there's fatigue that comes with that. And that's another thing that we have recognized through engaging with different communities is there's, yes, educating, yes, sharing your story, yes, being heard and seen. But at some point, there's also, you kind of start getting into an overlap with what you can almost refer to as tokenism, where you're going to get a group of status quo maintainers, let's call them that are going to hear you and they're going to say, great, thank you so much. Boxes ticked.
Yeah.
Next. And then move on, right? And then you just walk away from that feeling completely drained because you just emptied yourself out and nothing got done about it.
Right.
So are you one of them?
I am not. I was about to say, so I work with a team within the Department of Health and Wellness, and we're a new team. We started in May of 2021 under the executive leadership of John Arroyo. He is a rising star in government working for the people, right? And specifically our equity group folks, racialized folks, all of these folks, because he comes from an immigrant background. He comes from Ontario. He's only been here for under 2 years.
Okay.
And so he went and got me. He went and got Colin Campbell. He went and got project director for the Health Equity Framework, Eric Hemphill, and Karen Mutiabele, who's our African Nova Scotian health advisor. We're building a team of folks that want to make a difference.
Right.
We care about the work we do. And this is why we're doing it.
Yeah.
It's not just a bureaucratic pushing paper, another survey, another policy kind of job.
Those things will make us feel safe. Do you know what I mean? Like those efforts are really needed.
Yeah, for sure. I mean, especially in like healthcare is such a vulnerable thing. Like it's something like you can't fix it yourself. Like you need to go to somebody. You need to see
Yeah.
a professional.
We'll put the survey link below, also QR code here, like right on our faces, like 3 QR code. Scan us.
Yeah.
And of course, if you have any questions or reservations about how your information will be used for the survey, feel free to send me an email. You can give me a call. We can talk about it. All of that stuff. We do have very strict privacy policies. We are following FIA. And so none of that will be shared. And your data will be completely disaggregated. So anything in terms of your IP or you individually will not be attached to the data point you create by filling out the survey.
Okay, so next one. So what does multicultural mean to you?
A multicultural society to me is an inclusive society, reduced if not lowered completely all the barriers to all the different cultures that may want to participate. That's what that looks like for me.
Wow. Wow, that's so deep and wise. A multicultural society to me, or like walking into a room that's multicultural, is somebody can walk in and feel like they feel safe and feel seen and represented, no matter where they're from or what they look like. And I think that's what we should be striving for. I think that's a very like up in the air kind of answer, but like when I think of multiculturalism, like the first thought I have is like safety and the feeling of feeling seen and represented.
I hear you.
It's almost like a sense of comfort in yourself and that ability to be 100% yourself without putting anything on. Like, for example, the way like me speaking like this, like I have a Canadian accent or a Canadian twang, but like if I'm talking to my parents, I don't sound like this when I talk to my parents. But if I'm in a room with like other multicultural people or like people from like the Middle East or people from South Asia or something like, or people who are diverse to me, I'm able to be a little bit more myself because I feel like I don't have to put something on to be understood.
Yeah.
Which is like, I feel like that's my, like everybody has their own experiences and that's mine. So I just feel like that safety to just like be myself and not have to tone myself up or down.
In the work that I do, a lot of what you're saying right now is a lot of what we hear.
Yeah.
A lot of what we hear. And that comes back to what we're starting to refer to as cultural humility.
Okay.
If everyone in the room has cultural humility, then everyone participating can feel comfortable and safe. That includes your white folks to your racialized folks and everyone
Right.
in between.
So following up with your answer, any stereotypes you want to break?
I think with South Asians, a lot of it is everybody from South Asia is the same, and they're all like math geniuses who talk like this, like Apu from The Simpsons. And it's not like that. Like, I think just even how within the Indian subcontinent, how different every single region is, and it's so beautiful to see how India alone as a country has so many cultures and so many languages and things like that. Like, it's like a continent within itself. But even spreading that out to like Pakistan or Afghanistan or Nepal or even Bangladesh and things like, kind of understanding that nuance in the South Asian experience, I would love to have that a little bit more seen.
Yes,
Yeah.
yes. We should follow Sammy and see her content. I watch Sammy's content a lot, like
Yeah.
sometimes when she react this stereotype situations, it's very fun.
Well, what about you? Where do you want to go in Asia?
I want to go back home right now.
Okay.
I haven't been home for 7 years.
7 years?
What a sin.
Oh my God, my heart breaks for you.
I think the one thing I want to go travel right now is home. Thank you, Raoul. Thank you for the information. It's so useful.
I'm so happy I was able to come. Thank you so much. Nice to meet you, Sammy.
Yes, nice to meet you as well. Thank you for sharing this. This is so cool, and I'll definitely send this out to my friends and stuff.
Awesome, sweet. All right, I will see you in the new year. Bye. Bye.